This is Stacy, and we're going to talk about managing costs and budgets. Healthcare cost. Healthcare costs, we spend about $2.6 trillion a year in healthcare. It's 17% of our gross domestic product, and gross domestic product is the broadest measure of health of the U.S. economy, yet millions do not have access to basic health care. With the exception of South America, the United States was the only industrialized nation where healthcare was viewed as a privilege rather than a right. Our infant mortality rate is among the highest in an industrial nation. That equals a healthcare disparity. Life expectancy is lower than it is in most developed countries, and men have a life expectancy that is 6 years less than that of a woman. 1 in 8 women will develop breast cancer during their lifetime. What escalates healthcare cost? Unnecessary care as prescribed that doesn't contribute to the well-being of a patient. An example is an additional lab tests that are unrelated to the plan of care. A consumer's attitude to be fixed. We should be practicing prevention. We see high tech as the best fix. Healthcare financing, we don't know what things cost, not even really given an incentive to shop around for the best deal. So it's one of the only industries that you go into and you have no idea what you're paying for that product. Pharmaceutical use. Pharmaceutical companies influence the consumer with ads in the magazine and on TV, and we go to the consumer asking for that certain product. Changing population demographics, we have an increased volume of health services needed, an increase in older population. Baby boomers are moving into their senior years over the age of 85. And our disease patterns, obesity leads to heart disease, homeless leads to TB, we see that in people who have drug addiction. Do we get what we pay for? Healthcare disparity is based on gender, race, and social economical status. For instance, African Americans have a lower rate of breast cancer than a Caucasian woman, but they have a higher fatality rate. That is a healthcare disparity. U.S. infant mortality is among the highest in the world, and U.S. life expectancy is lower than many other developed countries. With these facts, it is clear that we are not receiving high value for the amount of money spent on healthcare. So how is healthcare financed? You can see the government pays 45%, private insurance companies about 36%, individuals 15%, and other is 4%. Private insurance companies, although they pay more of the overall percentage, are composed of numerous individual businesses. Almost 75% of government spending is at the federal level. Because government pays such a large percentage, you can see how the Centers for Medicare and Medicaid Services greatly influences what happens in Medicare. So Medicare and Medicaid. Medicare has Part A, which is payment for hospital, hospice, home health, and skilled nursing. Part B pays for the provider, medical equipment, and diagnostic, and Part D pays for drug benefit plans. The primary payer of the health insurance is Medicare. Part A covers organizational services such as hospital and home health. As I said, Part B, which is optional, provides healthcare provider payments, medical equipment, and diagnostic. And then in 2006, Part D, the drug program, went into effect. Medicaid then is at the state level. It's a state level program, and medically indigent, blind, or disabled, or children with disabilities. And the federal government pays about 50 to 83% of that. The funding from the federal level is dependent on per capita income of the state, in addition to the growing medical and indigent, who are the population the public usually thinks of as being targeted for this program. Medicaid covers persons with disability also. So how are payments made? Charges are the cost of providing a service plus a markup for profit. Usual and customary is a term that means third-party payers have surveyed providers in the area to establish what the payer will pay. So a hospital could tack on a markup and not necessarily receive it back because it far exceeds the usual and customary charge. If it is a cost-based reimbursement, it calculates all allowable costs and then uses that as a basis for payment. Each payer determines what allowable costs are, and both of these approaches have been largely replaced by payer fee schedules. Flat rate reimbursement is based on the payers deciding in advance what the payment will be. If costs are greater, the provider absorbs the cost. If the costs are less, the provider absorbs the benefit. Capital payments are based on the provision of a certain services to an individual over a set period of time, such as a year. The per person fee is set, and the desire is to provide needed care at the lowest cost possible while meeting the standards of quality care. We hear a lot about managed care. It's the most common forms of managed care are health maintenance organizations, which you guys know as HMOs, or PPOs, which are preferred provider organizations, and then there's point of service plans. They all come with various pros and cons. Obviously, the first and main advantage of managed health care is the lower cost associated with them. The other thing is that the other advantages are the aim of managed care is to keep healthcare costs down without sacrificing quality, and they have accomplished this by contracting healthcare providers and referring these to enrolled members for available services and procedures at a discounted rate. This type of healthcare is the most attractive for employers who seek to provide medical care benefits to their employees without having to shoulder or have an exorbitant amount of fees. Another advantage seen by many in managed care networks of healthcare providers that are readily available to them. These healthcare professionals and facilities have gone through an accreditation process. Their credentials and experiences carefully analyzed and have been deemed as having an innate capacity to serve members with quality care. This is important to members in that it gives them peace of mind to know that they are in good hands when a medical need arrives. Then they can be driven to the right place by their primary care physician. So what are the disadvantages of managed care? On the other side of the coin, when it comes to managed care, for some members is the rigidity of the rules concerning the choice of healthcare providers, which is especially true for HMOs. In some cases, a member may not be fully satisfied with the care that is given by a primary care physician and would want to consult with another who is not included in the network available through their managed care provider plan. The only resource would be to do so and pay the expense in full out of pocket. There are those who complain and speculate that in order to save money, their managed healthcare providers contract inexperienced, less educated doctors and healthcare professionals. Others have reported that for the sake of saving money, their primary care physicians skip on tests necessary for members to go through in order for their conditions to be properly diagnosed. One more criticism against this type of healthcare is the strictness of them, and they have to be followed. For instance, they need to obtain approval from insurance provider before any treatments can be started or given, and sometimes it takes a long time to get okay for services. What does it mean for nursing then? We must focus on patient needs, not provider needs or organizational practices. We must provide evidence-based practice for the public we serve, and we must incorporate and evaluate new technologies, and we must use research to better our practices. Understand how to remain financially sound. A number of patients needed to make profits, so we have to understand how many patients have to be seen through a clinic in order for it to make profit. In a fee-for-service environment, we get paid for services provided. Increased services such as diagnostic testing might not be covered. In a capital environment in which one fee is paid for all services provided, we must accomplish more and less visits, and we want to decrease the number of return visits. We should also know cost and reimbursement practice. Know what things cost and how they are reimbursed for the service. Know patient goals and expected outcomes, and know your insurance companies and what has to be pre-authorized or service required or required vendors. Use time efficiently. Time is money. We need to be organized and efficient in providing care and work to decrease work visits. Discuss cost of care with patient. It is uncomfortable, but we must talk with patient. We can help patients find ways to cover cost. Evaluate cost. Talk about a Pyxis system for simulation. Is that effective? That costs $30,000, so is it effective? Predicting and using nursing resources efficiently. Nurses are the largest part of the operating budget, and staffing correctly can help manage budgets. Nursing is a variable cost. Costs are vary in direct portion to the patient volume. Fixed cost, rent and utilities and administrative costs is a fixed cost. Those needs don't change based on patient volume. Using research to evaluate nursing standard process is a must. And there's a nice summary box on page 221. Types of budgets. Operating budget is a financial plan for the day-to-day activities, expected revenues and expenses generated from daily operations. Capital expenditure budget then reflects expenses related to purchases of major capital items such as equipment or physical plant. A capital expenditure must have useful life of more than 1 year and must exceed a cost level set by the organization. Minimum cost requirements in healthcare usually are around $300 to $1,000. Your cash budget then is the operating plan for monthly cash receipts and disbursements. Organizations must pay bills on time to survive, and you can be making a profit and still run out of cash. What is a nurse's role and type of budgets? You must understand there may be constraints on spending even when the expenditures are budgeted, and the importance of careful predicting when budgeting items will be needed. The budgeting process, we have to gather information and plan and develop our department's budgets and develop cash budgets, negotiate and revise and evaluate our budgets. So it's a lot like the nursing process. Price, utilization, and cost. Price is the rate that healthcare providers set for services they deliver, such as hospital rate of a physician fee. Utilization is how much something is used. Quantity or volume of services provided, such as diagnostic tests provided or number of patient visits. Cost equals the price times utilization rate. What causes prices to increase then? Insurance premiums, medical technology, drug cost, waste. Example of waste is clerical personnel used to process reimbursement forms from multi-payers. 20% of a hospital's budget is on billing administration alone. Example of income statement then can be found on page 218. Healthcare financing and nursing. Knowing how each affects the other and knowing how to talk in terms of value of care are skills that nurses need to be financially savvy.